Hello angels, welcome to another video. Today we're going to talk about what is a doula and why do you need one. So May is International Doula Month, and I felt like this would be an appropriate conversation to have about what exactly is a doula, what do doulas do, and why would a mom or family want a doula. So doulas are basically, we are generally women that help moms throughout pregnancy, throughout labor, and even into postpartum. So doulas come in many different types. There are birth doulas, there are postpartum doulas, there are fertility doulas. There is a whole gamut. And if you guys want me to, I'll do a video on all the different types of doulas. I personally am only a birth and postpartum doula. I don't really get into any of the other areas, not yet. Maybe that is something that I will do in the future. But as of now, I feel like being a both birth and postpartum doula is more than enough excitement for me. And those are two areas that I really enjoy and I'm fascinated by. So I try to stick to what I know and what I love. That's really important to me, to be doing something that is exciting and that is fascinating to me. And so that's why I chose to do both birth and postpartum doula work. Now, as far as a doula, let's talk about birth doulas first. Birth doulas support moms. We educate moms. We encourage moms. We are there for physical, mental, emotional support of moms. If you have had a baby before, or if you've been in close proximity to someone who's either pregnant or has given birth, you do know that there is a lot involved in that process. And during that time, women really need to feel supported. Doulas have been proven to be effective in terms of, as research is slowly coming and evolving and showing us that doulas are very important in helping to reduce the risk for cesarean births, and also helping moms in terms of being able to feel more comfortable and things like that. And so doulas become very important in the birthing process, and they're very important in terms of helping the family to adjust to this new family member. So when you think about a doula, you're thinking more of a non-medical person. A lot of people are confused about what's the doula's position in relation to dad? Are they taking the place of dad? What's the doula's position in relation to the nursing staff? You know, how does the doula fit into this picture? The doula's job is to support mom. I always think of it like this. If you have medical staff and you have your spouse, this is a traditional situation that tends to happen, because a lot of women will have babies in the hospital. They'll have their spouse and they will have their medical staff. Your medical staff is there to take care of all of your medical needs. They're there to assess you, protect you, and help you during labor. They're there to teach. You reach out to whether that be an advanced practice nurse that you're seeing, or whether that be your obstetrician, or if you have a midwife. These are your medical professionals. They're going to take care of all of your medical needs and things of that nature, right? And emergencies, right? The doulas are there more as a support person. So this is where the two are different. We are there to support. So doulas can wear different hats. You do have doulas who are nurses. You have some doulas who are physical therapists, massage therapists, the whole gamut of any other professional. A doula can be both, right? You can't act as both in the same situation. You have to wear different hats, right? Depending on what you're doing. But there are doulas who have many different specialties. There are doulas who have a gamut of education and backgrounds, right? And so some doulas choose to mix and match those things and offer different packages based on their expertise in various areas. And so it can kind of get muddled, but the thing to remember is, when we're thinking about doulas, a birth doula is there to support you during pregnancy, birth. A postpartum doula is there to support you during your postpartum period. So what does that look like? For a birth doula, it looks like being there during your birth, supporting you and helping you with comfort measures. It looks like encouraging you. It looks like giving your spouse a break when they need a break, making sure that the entire family is a part of the birth, if that is what the parents want. And it's basically honing in on what exactly mom and dad want to have a dream birth. What do they imagine that this birth will be like? Doulas also play a protective role, so to speak, meaning that when a mother is having a baby, we know that the most optimal situation for giving childbirth is in a peaceful and safe environment. And a lot of times that can include making sure that the light is low, making sure that the room is quiet, making sure that there aren't any intrusions on mom, making sure that she has her 5 senses stimulated in a way that is beneficial to her, that feels good to her, that is facilitating bringing baby into the world. So that can include essential oils. If you watch my video, I did a video maybe a week ago on what's in a doula's bag. And in that bag, it kind of gives you an idea of the many different things that doulas can bring to a birth to help mom to be more comfortable, to help her to feel more safe and secure during her delivery. So that is what birth doulas do. That's just a tidbit. There's a lot more to that. I won't go into all the great details in this video because the video will end up being too long. There is a lot that doulas can do to help. A lot of it is teaching. A lot of it is breastfeeding support. That's another thing that doulas will do. Helping mom to identify when is a good time to possibly start talking about going to the hospital or calling your medical provider. Sometimes women will reach out to doulas to ask, well, how will I know when I'm in labor? How will I know when to go to the hospital? There's a lot of questions that are asked to doulas. So we're more of a resource person. We're more of emotional support. We create a comfortable environment and a safe environment emotionally for mom to deliver. So these are birth doulas. Then you have postpartum doulas. Postpartum doulas usually will sometimes you can go from birth doula to postpartum doula. Postpartum doulas are generally there to help take care of baby. So postpartum doulas know how much you should be feeding baby, when you should be feeding baby, how is baby doing, is baby able to tolerate the milk that they're getting, is there something that needs to change with the sleep schedule. All of these different questions are questions that postpartum doulas get, and they help to facilitate adjusting this new family member to your family. This is what doulas do. So a lot of that work is physically demanding. If you think about a birth, babies come when they want, right? They don't ask for our permission before they come. They come in the middle of the night. So a doula may work a night shift, right? She might get up at 10 o'clock. I've had a birth where I had to get up at 10 o'clock after I got in bed, and I had to go, and I was there until the next morning at 6 a.m. Helping a mom through her birthing process. And so there is no cut and dry schedule for a doula because babies come whenever. They may come in the morning, and so you get up and you go when your client is in labor, and you proceed from there. So that's birth doula work. Postpartum work is more about taking care of baby, making sure that mom isn't experiencing any postpartum mood disorders, looking for kind of the signs of things of that. Now, we're not clinicians, so we don't diagnose these things, but we do ask questions. We do kind of look out for certain things to make sure that mom is getting the help she needs. There are many different things that can happen to a woman because of hormonal shifts, because of just different things that happen during birth and being pregnant, that could predispose mom to things like postpartum depression or postpartum mood disorders. And so we need to be on the lookout for, is mom able to take care of this baby and take care of herself after giving birth? And then if we see something that may or mom may say something, she may come to you and say, hey, I'm not really feeling like myself. Is this the normal baby blues, or is this something more? And at that point, doulas can actually give mom resources for, psychiatric nurse practitioners or psychiatrists or therapists, or, just point them in the direction of where they can get this help. As a doula, a lot of my work involves problem solving. So if you are an aspiring doula and you'd like to be a doula, one of the qualities you want to have is to be able to resolve problems, because you will have to resolve a gamut of problems. You have to be very, very good at problem solving as a doula. Generally, almost all of your work outside of just being there for the birth is problem solving. And there are many different problems that you'll have to solve throughout the birthing process. You're going to have to help mom to solve these problems. Now, again, for birth doulas, when birth doulas are working, we try to work cohesively, respectfully, and professionally with other medical professionals in the hospital, in birthing centers, wherever we are. We want to work with the medical team, and I fully push this, and I advocate that doulas and medical professionals have good relationships, and I always try to be polite and professional and have a great relationship with any medical professional that I come into contact with. I think that's extremely important, because at the end of the day, the client is the most important person in this, and both the medical team and the doula are working to bring out the best outcomes for this client. And so we work as a cohesive team. We do different things, but we have the same goal in mind, which is the best outcome for the client. And in the case of the medical professionals, the best outcome for their patient. And so with that being said, we're always making sure to never overstep our boundaries and practice outside of our scope and get into medical things, and to stay in the doula's world and respect the medical professionals, because that is their specialty, and always refer the mom or dad or family member back to their medical professional for any sort of medical anything, right? We don't do interventions, we do not do anything medical at all, unless you're a medical professional. And then of course, you still have to operate within your scope of practice as a medical professional, but generally doulas do not do anything medical. So I just want everyone to understand that is the difference between a doula and a medical profession. A doula is non-medical. We provide support, we provide resources. I would say, a great percentage of my job is being able to, if I can't resolve a problem and solve it myself, finding someone else who can. After birth, sometimes moms want referrals to pelvic physiotherapists. During pregnancy, they may want referrals they want to find out about a pregnancy yoga, prenatal yoga. They may want to know about all kinds of different things. They want to know that if you don't know the answer, you can find the answer, or you can find someone who knows the answer. That's a really big part of being a doula. And so you want to make sure that your clients feel comfortable that if they find themselves in any sort of bind, that you will either be able to help them or connect them with someone who can help them. That's whether you're a postpartum doula or a birth doula. It doesn't really matter. So if you're thinking about being a doula, sharpen up your problem-solving skills, sharpen up your analytical skills, because a lot of people think doula work is all foo-foo and it's all Erykah Badu, and it is. A lot of it is holistic. A lot of it is, for some doulas spiritual, and for some clients spiritual, right? But there's also a lot of thinking, problem solving, and being able to be resourceful. This is very important. What else? It's International Doula Month, so I kind of want to really paint a good picture of you guys. What is a doula? We don't do, like I said, we don't do anything medical. I think oftentimes we get confused with medical professionals quite a bit, and I just want to make that clear that is not what a doula does. You have doulas who are medical professionals. For instance, you may have a doula who's a nurse, right? So some doulas will offer baby nurse services because they're nurses, or some doulas may offer massage, right? Because they're massage therapists. So they may have those as separate packages outside of what they do in terms of being a doula. And that's at the discretion of the client, and that's at the discretion and their professional work of that professional. But that is definitely outside of, and it's not included in being a doula. So yeah, that's it for now. If you guys have any other questions about a day in a life, what my life looks like as a doula, I'm willing to kind of go into some of those things. I'm a very private person. I can't even believe that I'm doing YouTube, because I do tend to be extremely private, but I do enjoy teaching. I love to teach and I love to help, and so I felt like this would be a great way to teach and a great way to help. and to grow myself and develop myself so that I'm not sticking only to the things that I'm either good at or that I love, and also expanding and growing. So that's why I chose to do this channel. But just know that if I don't answer any questions, I am a very private person, so I won't go into a lot of the personal things. I will talk about myself professionally, but not personally. So if you direct any personal questions to me and I opt out of answering those questions, please don't feel offended. That's just kind of who I am as a person. And I will try to be helpful to you. Like I said, if I can't answer the question for you, I'll find someone who can. To all of my doulas, happy and merry International Doula Month. I hope you enjoy the month of May, and I will see you guys on the next video. Bye.